4-day-old term baby admitted from the postnatal ward with yellow discoloration of the eyes and skin and poor weight gain. Could this be breastfeeding jaundice? Let's break it down. Breastfeeding jaundice is one of the most common physiological causes of jaundice in neonates, as it usually occurs after the first 24 hours. It is usually caused by insufficient breast milk during breastfeeding, which then will lead to dehydration and therefore lead to delayed passage of meconium and bile in the intestines. And this will then lead to or facilitate enterohepatic circulation. So that's the pathophysiology. It is usually a diagnosis of exclusion. As you're examining the patient clinically, you have to make sure there is no red flags of other causes of jaundice, like signs of sepsis or signs of hemolysis. We assess the hydration status of a neonate by the weight, as it is difficult for us to find the obvious signs of dehydration in a neonate that you would look for in a bigger child. Therefore, it is important for you to compare the birth weight of this patient with the current weight that you are having right now. Neonates are not allowed to lose about 7 to 10% of their birth weight. If that is what is happening in your patient, then you can safely say that your patient is dehydrated, and on top of the feeding, the patient might need to be rehydrated accordingly. So as you are examining this patient and admitting this patient, two things you need to take into consideration as to trying to find the cause of insufficient breast milk. You're dealing with the mother and you're dealing with the newborn. You need to find if there's any maternal factors that are affecting this. Is this a primigravida who doesn't know what she's doing and therefore the breastfeeding technique is the problem? Or she just doesn't have breast milk, she's still dry, or she has inverted nipples. She has breast milk and the baby is sucking well, but she just has inverted nipples. Or is the problem the baby? Maybe the baby is having poor suck and the mother doesn't have any factors contributing to this. It's just that the baby cannot latch on the breast. So those are the factors that you need to take into consideration. As we have said, this is a diagnosis of exclusion. So on physical examination, you are just supposed to find a jaundiced baby who might have some excessive weight loss. Other than that, there isn't supposed to be any red flags of sepsis, no signs of sepsis, and no signs of hemolysis. It is supposed to be a well-looking jaundiced baby with some weight loss. So if there isn't any red flags on your physical examination, the only investigation that you would need to do is a total serum bilirubin and a direct bilirubin. And we are expecting an unconjugated hyperbilirubinemia. If your TSB is above phototherapy, then you can safely start this patient on phototherapy. If the patient is having excessive weight loss, be sure to rehydrate the patient. Non-pharmacologically, you support the mother. Make sure she tries to express so that we can see if she does have enough breast milk. If the problem was the technique, we teach her the technique. What we also do make sure that we do is to make sure this baby continues breastfeeding. There is no contraindication to breastfeeding. Our job is just to make sure the baby is getting enough breast milk.